Instructor Mallet. I will be doing my presentation on Home Visits, a program sponsored by the Administration for Children and Families. This program supports maternal, infant, and early childhood. First of all, the modification I've implemented onto the program is the early intervention for children suspected to have ASD. This program will serve at-risk families with children 0 to 5 years old with low income in the greater Los Angeles area. The program overview. The home visiting programs reaches the homes of families that live in at-risk communities. Visiting programs are for pregnant mothers, expecting fathers, parents, and caregivers of children under the ages of 5 years old. Having home visits will help families with limited access to health care services get connected with professionals for early detection of autism. Autism occurs in people of all racial and ethnic socioeconomic levels. However, limited resources for low-income families may delay a diagnosis. Doctors are now able to observe symptoms of autism in as early as 6 months. Early intervention on children diagnosed before the age of 2 has significant improvements in the quality of life and of parents and caregivers as well. What is autism? Autism spectrum disorder refers to a collection of neurodevelopmental disorders. Autism is characterized by an array of communication, behavioral, cognitive, and social challenges. The severity of autism varies substantially. Some individuals with ASD are categorized as high-functioning autistic, while others have severe behavioral and cognitive challenges. Within the last 2 decades, the growth rate of autism has been alarming, and its etiology remains unknown. So what are the benefits of early intervention? First off, improved speech. One of the main symptoms of ASD is delayed speech or the absence of speech. Therefore, speech therapy or talk therapy is a fundamental treatment for ASD. Second is social skills. Social interactions are a core problem in ASD. There is evidence that interventions to train social skills can be effective in eye contact, joint interaction, and verbal communication. And academic success. Early interventions in developing speech, language, and social skills are building blocks for future academic success. The appropriate ages for early intervention are from 1 to 3 years old. Studies show that these children benefit from beginning intensive early intervention as soon as possible. Early detection enables children with suspected with ASD to be evaluated by specialists and entered into treatment programs at the earliest possible opportunity. The Early Start Denver Model Intervention Program provides a minimum of 15 hours of therapy per week for 2 years. So what is the expected outcome of this program? The expected outcome of the program is to have very young children catch up in the verbal and social skills of other children without ASD. Children with high-functioning ASD have a harder time making friends and are excluded by other children because they behave differently. By closing the gap in verbal and social skills, children with ASD will blend in with the rest of the students, which will result in less social stigma. The method I would use to assess the outcomes of the program would be an initial assessment which focuses on verbal, language, and social skills prior to the intervention, and a follow-up assessment to measure language and social skills compared to children without ASD. The developmental theory that applies to the utility of the program, in my perspective, would be Bronfenbrenner's ecological systems. His system's perspective represents the influences from multiple settings which children encounter the interaction between these systems and the influence they have on the individual over the life course. The actions taken by people in each of the ecological systems have a significant impact on the life of a child with ASD. As we can see, early intervention in children with ASD will have lifelong benefits, and the same can be said if no treatment is provided until school-age years. Given the current data in early intervention, we must do our best as a community to help children and families of children with autism spectrum disorder.